Hello and welcome to the Curiosity and Consciousness podcast. The intention of this podcast is to open your mind, get curious about yourself and connect to the power you hold within. I am your host, Karen Maloney, an inside-out coach, helping you to believe in yourself and manifest your desires. Check out the podcast, available on all platforms, and go to my website, www.karenmaloney.com for all info. Hello. It's me, Karen Maloney. Thanks for tuning in again, back with another episode. And again, this is a series focusing specifically on cancer. I took a break. I've been working on this behind the scenes. I'm so excited to connect to all these wonderful practitioners, doctors, survivors for this series. And again, my intention is never to say, this is exactly what works, or these are the remedies and tools that a person should follow. I think every journey is individual and it's all about listening to your own truth. But hopefully some of these stories, some of these modalities might give you that confidence, that faith, that trust in yourself. If something that someone mentions or talks about in one of these episodes was something that you were curious about or interested in, maybe by learning more and knowing that there are lots of options as well. And this is not to say allopathic medicine doesn't work. Everything serves a purpose, but we all know what the allopathic options are, but they're in and of the same for every single person. So these are conversations as well, expanding beyond that. And so my guest joining me today is Dr. Maria Amasanti. And Dr. Amasanti works as a general practitioner for the NHS in the UK and as a naturopathic and functional medicine physician. She studied at the University of Oxford and King's College London. She is also a member of the British Society for Ecological Medicine. Before coming to medicine, she worked in television and film, predominantly in football. Dr. Amasanti is based in London and works with patients from all over the world. Her main aims are to treat her patients as naturally and holistically as possible, as well as to empower them with knowledge so that they can learn to care for themselves and their loved ones in the best possible way. And I think that's the thing that Maria talks about most in this conversation, is this sense of empowerment, that we're not hopeless, that anything can be reversed and undone, that the body is incredible and that it's never too late. And that, I think, is her message in a nutshell, but it's about, for her, educating her patients, empowering them to know their power, to know what things they can do, that any single one of us can do, that are supportive and beneficial to us. And she talks about some of those in this episode as well. She also talks about the constraints that doctors are under, and especially time constraints that doctors are under in the medical model, and how especially for cancer, it's not a one size fits all, or for any chronic issue really, it's not a one size fits all, and people need more time than being on a conveyor belt going through a doctor's office. She talks about how the mind and body are so connected, how everything is linked to everything within the body, and how energy follows thoughts. And when we become more conscious of these things, again, we can make changes in all these different areas. She also talks about the book Radical Remission by Kelly Turner and the steps that people took in order to survive and thrive and reverse and heal themselves of cancer. So lots in this episode, and if you want to find out more about Dr. Amasanti's work, you can go to her website www.dramasanti, and that's dramasanti.com. But as always, I will have all links as well from the show notes on my website, karenmaloney.com, and click the podcast section. Enjoy. Dr. Amasanti, very welcome. I hope I pronounced your surname properly, and thanks for joining today. I'm excited to connect.
Hello, Karen. Thank you very much. You did say it correctly, and please call me Maria. That's absolutely fine.
Thank you. But it's a pleasure to connect, and thanks to Julie Ryan as well, a previous guest who's put us in contact. And I'm putting together this series on the podcast about cancer just to expand the conversation and learn a little bit more about what's happening in the body, the power of our body, and different modalities. And it's not to say these are the answers, but just to maybe educate people a little bit more and take some of that fear out of it, which I know it had for me. So I'm really looking forward to this conversation today. And I'd love if you just give a little introduction to yourself, and especially why or how you merged the general practice with the naturopathic and functional medicine.
Yes, sure. So even as a child, I was always into kind of herbal remedies and reading about things like that. Never did anything with it, but it was always something I wanted to sort of know more about. So when I went to medical school, what I realized as the course went on was that we had it was a lot about symptom control, rather than doing a deep dive on cause, for example, and very little, if anything, on nutrition, for example. And it wasn't like I was going to medical school expecting to learn about herbs, of course. But for example, I knew that aspirin came from a certain plant, came from the willow, and different medicines had always had their roots in nature. And then as I started practicing as a doctor, if somebody came in with high blood pressure, then rather than look at factors such as, say, stress and, why have you got the high blood pressure? It was often the path of least resistance, which was, well, let's just put them on a pharmaceutical to bring it down. But you're not getting to the root of it. It's like putting a plaster over it. The same with diabetes, for example, type 2 diabetes. It can be reversed, as we've seen, and it's been well documented, well published, that through diet and lifestyle, not only can you improve it, you can stop it, you can reverse it. And there are doctors in the UK and abroad doing that now, but that is not it's not the mainstream treatment. And I think partly it's difficult because we're so pushed as doctors, time limited, and it's kind of a conveyor belt sort of thing that you've got to get these patients through, and these are the guidelines, this is the protocol, next. And it's not a one size fits all. And for example, the link between stress and blood pressure is huge. We know this. We see there's something called white coat syndrome, for example, which means when a patient comes into clinic and you take their blood pressure, we know that quite often it will be higher than what their baseline really is. So it just tells you that a slight amount of stress can increase your blood pressure. So we know that. So why do we not do a deeper dive on thinking, well, imagine if just coming to see the doctor and sitting to have your blood pressure takes your systolic pressure up by 10. Imagine if you've got a really demanding life or family issues, financial issues, health issues. What is that going to do? And if we know that the minute that stress is relieved, i.e. you leave the doctor's office and your blood pressure comes back down, so, well, what could we do for all the other factors in life? So lifestyle, so mind and body are just inextricably linked. And if there is a stress going on, it often comes out sideways in the body. And I often tell my patients that actually we are like, I use the picture of a cobweb to the power of a bazillion. Imagine you've got this 3D cobweb and the most beautiful matrix you can imagine. You pull on one thread and the whole thing shudders, right?
Yeah, that's powerful.
So everything is linked to everything. And if we could, by just investing a little bit of time and education for patients, but again, we're under time pressure, but if we could teach them about ways to deal with that and things that we're holding inside, if that could bring down blood pressure, imagine what a beautiful place this would be.
Absolutely. Yeah. And it's funny because I worked with a heart and stroke charity for 5 years. And initially, all the funding was about getting cardiac services in the west of Ireland because they didn't exist. You know, if someone had a heart attack, they're on an ambulance to Dublin. But now that that's all in place, it's all about prevention. That's the space they work in because, like you just said, it's scientific. We can reverse it, prevent it up to 98%. But still, why do you think people don't get it? Because I know, like, people didn't get it and they'd be like, yeah, but I feel fine. Even if they never exercised, even if they never ate a vegetable or fruit or anything, they're like, yeah, but I feel fine. What are you on about?
There's a couple of things. You don't know what you don't know. So if you're not educated in that area, and that's by no means, it's not your fault if you don't know.
Yeah.
But if somebody hasn't been able to explain to you, well, look, your body is going to hold out as long as it can, as best as it can, until it has to just give in, right? So, because when we're born, we are pristine. We have everything we need. We have our mother's immune system. Every organ is just shining and glistening. It's all perfect. So why do we then get these diseases or injuries? So, for example, I will use, if I'm trying to talk to somebody about blood pressure, and they say, well, I feel fine, because very often they do. They have no idea that they're walking around with high blood pressure. And I use the analogy, I say, well, imagine you've got a hose pipe and you've got water flowing through it. So that's your vessel with your blood going through it. Now, if I squeeze just a bit on that hose pipe, what's going to happen? Initially, nothing, right? You're still going to feel fine. The water's still going to go through. And then if I squeeze a bit more, or if I fur up the inside of it, eventually, if I'm holding on to that, what's going to happen? And every single patient, because I hold a tube there, I hold my blood pressure monitor tube, and I say, what's going to happen if I squeeze that harder and harder? And they go, and then they realize that it's going to burst, i.e. heart attack or stroke or whatever. And, once you have knowledge, that is your potential power to then move forward and do things like prevention.
Yeah, I agree. And like you said as well, I love how, you mentioned that everything is connected to everything and we are a mind body and it is connected. And that analogy of the web is so powerful. And again, I do agree. And especially after my time with the charity, I learned so much about prevention. And again, the idea of, and this is the power of our body and how incredible we are, that we can get away with 30, 40, 50, 20, 60 years without something major. But then boom, there will come a point when it's oversaturated, when it cannot cope anymore, and then it will express in some way. Like that's just the way it is. And then when it comes to cancer as well, what's your understanding of what's going on?
So let's establish first of all that I would say 95% of cancers are environmental, i.e. it's hits that you're taking through diet, through your environment. Very few cancers are actually genetic, okay? And there was an advert on TV over here recently, or maybe it was a radio advert, and it said, 1 in 3 of us will get cancer. And I thought, what on earth? When did that statistic become normal? And why are we normalizing it as well? Because when we go back to just maybe our grandparents' generation, the levels of cancer were far lower, especially things like skin cancer, for example, that has rocketed. And it's unclear why, unless you dive a bit deeper. And so what has changed? Because our human body, as we are born, that hasn't, our brains are the same, our bodies are the same. Us as human beings have not changed since we were hunter-gatherers. So what has changed? What are the variables? So the variables are how we live now. Because if we were to look at the rates of cancer in, say, the Namibian trackers or tribal societies, it's still very low. You go to Japan and breast cancer is virtually unheard of, right? So what are the variables? And it is food, it is what we put in our mouths, it is what we put on our skins, it is what we breathe, and it is our stress levels as well. Because again, going back to the hunter-gatherer theme, we were not built for stress. We were built for short bursts of stress, right? So when that saber-toothed tiger is chasing us, or when we're fighting an enemy, or if there's a famine, then we are stressed and we release our stress hormones because we need to get away from the tiger. We need to beat our enemy. But that lasts 5 minutes and we're either dead or we've survived, right? And then our stress hormones should go down again.
Yeah.
But when we worry about modern day things, so our bills to pay, our family, our job, our housing, etc., our brain, our hunter-gatherer brain, cannot differentiate between the genuine threat of that saber-toothed tiger coming for us, where, yeah, we absolutely need our stress hormones get out of the way, or the perceived threat of how am I going to pay my rent. Our brain sees it as a threat and releases our stress hormones, adrenaline, cortisol, which are pro-inflammatory. Now imagine if you've constantly got this pulsating through you on a daily basis and you're working a 12-hour day and you've got a 1-hour commute each way and road rage, etc., you are pulsing out these stress hormones constantly, albeit at maybe a slightly lower level. But what is that doing to the inside of your body when you're putting it constantly, one, in a state of fight or flight, and two, in inflammation? That inflammation is one of the biggest chronic diseases we've got going on today, certainly in Western society.
Yeah, it's so true. And again, a lot of people listening, again, we know this information. Like a lot of people would know this, like it's been spoken about. But then what's the difference between, or what's the piece? What else do we need to actually hear it, but then action it? Actually, that preventative idea, like do something in advance of something happening. And again, it's nobody's fault. Nobody's going to know what's going to happen to us and all these kind of things. Like there's a multitude of reasons between that epigenetics and the environment that our cells are in, but also there's ancestral and emotional and mental stuff that we carry as well that's often unknown, and I believe it's a sum of them all. But how do you help people as well, maybe in your practice or maybe more the naturopathic or functional medicine side, to really make that connection and to, even if you feel okay, take the action in advance, or make your health, make what you're putting in your body, what you're thinking, how you're feeling a priority over just waiting for something to happen and then do it?
Well, I mean, by the time somebody comes to see me, it's normally because there is something already going on, right? But it doesn't matter because it's the perfect opportunity. It's never too late, ever. And the body has a huge capacity for regeneration. I mean, we know that you can cut half a liver away and it will grow back. You can live with one kidney. The body will do whatever it can to be as healthy as it can if you give it the opportunity. But coming back to your point, so when patients come to see me, they're coming because they have an ailment, they have a symptom. But it's not too late. You educate them there. For example, just knowing how to boost your immune system, right? With some basic micronutrients. We're talking vitamin D, vitamin C, zinc, stuff that is in our diet, but not enough these days, which, vitamin D we make from the sunshine. And when you and I were primitive women running naked under the African sun chasing deer for 10 hours a day, we got plenty. But now, certainly where I live, we're away from the equator. There's not a lot of sun. We're fully dressed. We're indoors. And we know, for example, that vitamin D is very anti-inflammatory. So it's always a wonderful opportunity to then be able to educate your patients and give them the knowledge, because in an ideal world, I don't want to see my patients, right, in the best possible way. I don't want them coming through the door, because if I can empower them with knowledge to know how to treat themselves, to know how to treat their loved ones, that is the biggest satisfaction, because it shouldn't be a paternalistic relationship that we have where I dictate and say, do this, but don't explain the why. When you explain the why to a patient, so this vitamin works this way, this micronutrient works this way, it will do this for you. You empower your patient, and then they raise their next generation with that knowledge as well, right? So it's whether they have You can bring prevention in at any point, even if they've already got symptoms, because you can undo things. And I think that brings me on actually to there was I don't know if you're familiar with Kelly Turner, who wrote Radical Remission.
Yeah.
So I think it's fascinating. It was called Radical Remission, Surviving Cancer Against All Odds. And she spent, I think, about a year in 10 different countries looking at cancer survivors and what were they doing differently when they had a prognosis of death. And the things that she came across were radical dietary change. That was number one, including water, so filtered water, eating as unprocessed as possible, staying really low on the food chain. They took control of their own health. So, like we were saying before we started recording, they didn't just outsource the management of their health. They were involved, they were proactive, they chose what they wanted. So if I was to say to you, Karen, the sky is green, and you say, well, she's a doctor, so she must be right.
I believe her. Yeah, she knows more than me.
Yeah, but I'm pretty sure it's blue. I'm looking at it, but no, I mean, maybe it is green. No, they go with their instinct and they take control of what resonates with them. Because remember, again, it's not a one size fits all. And what works for you may not work for me. A diet that works for you may not work for me because we're genetically different as well. They all took supplements and micronutrients because, again, even with a really healthy diet, these days you do need to boost it with extra. They all did emotional work because, as we were talking about before, mind, body, spirit, they're all linked. And the emotional work, and I can think of 2 patients I have right now, both women, both diagnosed with cancer. They have both gone on a journey of releasing, doing emotional work, and they are defying the odds. They increased positive, coming back to Kelly Turner's book, patients increased positive emotions, and their relationships mattered. Who they have in their network, their tribe, their loved ones, the supportive nature of that, the love, the unconditional love, no judgment. It's massive. We know that people who are lonely, we know that affects your heart. We know it affects your mood. We know it affects your immune system. So a massive factor. And the last thing in the 9 reasons she found was they all had a reason to live. And I've seen that countless times. And we've all heard the story of how, a father who's got cancer will hold on because he has to walk his daughter down the aisle and then he'll die the next week, or multiple examples like that, where somebody holds on or just they have to meet a certain goal or target, and they often do.
Yeah, it's absolutely powerful. And I've spoken to people as well before, and exactly about that as well. And, it's funny when you mentioned define the odds, because I'm like, is it really define the odds, or is it truly just working with our body? Because our body is a powerful self-healing mechanism. And with the right tools and the right support, it will come back, But this is, again, it's just like what you said about the sky, it's what we believe and what we've been told over and over again. We just believe is solid truth, and there's no other way. And especially when it comes to doctors. And of course, doctors do incredible work. I'm not saying that in any way, shape, or form.
Yeah.
But still, I'm like, they're just working with their parameters and what they know. And even when it comes to diagnosis, I know people as well who've just decided, no, that's absolutely not true for me. I do not have that, and went on those kind of self-healing journeys as well, or doing the emotional work, changing their diet, taking the power in their own hands and going, I'm not accepting this and I only have a couple of months or whatever it is. Because yes, it's true, but also there's been loads of studies done as well where people were given diagnosis and told they only had 3 months or something, and then in 3 months' time they had passed away, and on autopsy there was no sign of cancer or anything.
Yes.
And that again, to me, is the power of our mind and the power of belief. And that's a part that's often, well, in mainstream, it's not looked at because, again, like you say, you just don't have the time. And that's not what you're trained in either. It's more the symptomatic and deal with the symptoms.
Yeah, correct.
That mind body is.
Well, I often say to my patients, energy follows thought. And I always repeat it 3 times so that it really goes in. I say, energy follows thought. And if your thoughts are down and you're thinking, am I going to be able to keep my job? How am I going to make next month's rent? This divorce is so awful. My mother is sick. You can feel it now when we're talking. It's heavy. It's weighted down. It's low. Whereas the minute you focus on what you want, and even if you are in a difficult situation, if you can say, for instance, well, I have a roof over my head, I have water in the tap, gosh, I have food in the fridge, it becomes not a vicious cycle, it's the opposite. And they say, I have a duvet, I have this, and then when you start to think about the future, what you would like for yourself, I would like to be healthy, I would like to be able to run around the garden with my grandchildren, I would like to be able to just run and catch the bus, I would like to take a trip with my family. So immediately it feels lighter, right? Your hopes and dreams, what you aspire for, what you wish for, oh my goodness, it just feels so much better, right?
Totally.
So I mean, I don't have any proof of how that affects our chemicals, but I'm pretty sure it does, because we know that the mind and the gut talk to each other all the time. And we know that the gut makes most of our immune system. It makes our happy hormones like serotonin, for example. And if the thoughts in the mind are low, then what are we telling our gut that is producing our feel-good hormone, right? And vice versa, the gut talks to the brain. So if your gut is in disrepair through, if you've got leaky gut and it's inflamed and you've got maybe yeast overgrowth, then that can leak out into the blood system, and it can even cross the blood-brain barrier. And there's research showing that can then cause neuroinflammation. It can cause depression, low mood, etc. So everything is connected to everything. But what we can control is our thoughts. So to your point, what we choose to believe and what we take as we take things for, if someone tells us, it's like the emperor's new clothes, oh, look what beautiful gown he's wearing, and it takes a young child to say he's not wearing anything, and then people realize and agree with it, but we just kind of go with the flow. Someone's told me I've got 3 months to live, and you're absolutely right, you see that they just give up.
Yeah, and it's sad because, again, we do have so much faith in the medical industry because, again, it's incredible, and I look at it as an interventional medicine as well. Like, it is life-saving, it is epic, like the surgeries and everything, that wow, it just blows my mind.
Yeah.
But like you say as well, like what we're facing, the biggest killers are lifestyle diseases for the most part. Like, they're lifestyle chronic diseases. They're not interventional, they're not acute.
No.
And so that's why, it needs the bigger picture approach. It needs that little bit more time with that person. And if it's not your GP, well, then search out a naturopath, a functional medicine doctor, as something else, because you do need that information. And again, like you do as well, empowering your patient with the information, with the education, to go and take that piece and apply it to their life. Like, that's everything, because we are not helpless. We are not powerless. There is so much power we have. And I read a story as well about a lady who had cancer, and she's surviving, thriving, but she decided to call it, because again, even the word cancer, it just brings up so much fear. The body contracts, like, and this is my intention with these conversations as well, because that was me after seeing my dad's journey. Like, that word, I was like, oh God, no, if I ever got it, like, absolutely not, I wouldn't try anything. Whereas then, just from researching myself, learning, studying different things, hearing people's stories, learning about the body, I was like, oh, actually, it's not that scary. Like, yes, it's complex. Yes, it's multifaceted, but it's absolutely not impossible. But it needs the person's input. And if the person decides this is it, like, nothing's going to happen without her input. And that's in every aspect of her life. But she started calling it, and I can't remember exactly, but it was something like cuddly teddy bear. This is my cuddly teddy bear. And all her family, all her friends, she called it cuddly teddy bear. And whenever anyone spoke about it, they called it the cuddly teddy bear. But again, like you just mentioned, like in your body, you don't have the same reaction. So you can talk about it, you can converse, because again, our body's always listening to our mind and our thoughts. There is that biochemical, physiological response. So using a word like that, even, and people might think, oh, that's silly or that's crazy. But again, it's like, well, if it's my life and I have to live with this, why not choose things that make me feel better, no matter what?
Yeah.
And that's our power. That's our power.
It's a little bit like that fake it till you make it. I remember I attended this, there was this lady talking. She had nothing to do with medicine. She was a businesswoman, and she came to give a talk to some schoolgirls, and I happened to be there. And she said, just fake it till you make it. In as much as if you smile, even if you're feeling terrible, the physical links to the mental, and you will actually start to feel better if you hug someone for longer than 10 seconds. So hugs tend to be short. If you hug someone for 30 seconds, you start releasing the love hormone, oxytocin and things. So if you just smile, it will lift you even when you're feeling really blue. And to your point again, it's what your intention is, because so many times a surgeon, for example, he will carry out the same surgical procedure on 2 different patients or multiple patients. They will never respond the same, even though the intervention is identical. The incision is the same. Everything is the same. So why does one patient respond really well, and why does another one develop complications or take so much longer to heal? Right? That there has to be something there, because again, the variable of the surgeon doesn't change. I mean, he's not going to be identical on every day, but pretty much he's doing the same thing, right? The same way as when we're driving, we're carrying out all the same maneuvers. So therefore, the variable is the patient. So why is one patient making a remarkable recovery? They wake up from the anesthesia and they're cracking jokes. And another patient is possibly worse off afterwards and feels terrible, and just they're in constant pain and they're just not recovering. So why is that? It's outlook, it's attitude, it's coming back to sort of the 9 factors that Kelly Turner talks about in Radical Remission.
Yeah. And even studies have been done on identical twins, and the different paths, because again, it's like that. It's so individual, and we are the only power in our life. And again, that's not to say it's our fault or that, because we're so unconscious to what's going on, and even in the world and the energies and everything. And, that's a really difficult aspect as well, because even when you mentioned the hose earlier and squeezing it, and people may feel still okay, or even with blood pressure, they're like, yeah, but I feel fine. And that's the case with a lot of people with cancer as well. Like, it doesn't just appear overnight. I know tumors can take between 8 and 15 years to appear. So
Absolutely.
You're living with this for a long time. And I think, and I couldn't imagine getting the diagnosis myself, but I know how it affects a person, a family, a community. But a lot of people can go into, my body's given up on me, and this kind of sense of kind of victimhood as well. And it's like, there's been multiple things over years and years and years. But and I don't know how to word the question, but if someone is healthy, like they eat well, they exercise, and it's that person, it's like, well, they were the picture perfect of health. What's going on in those cases as well?
Well, look, no 2 cases are ever the same. Could it be that they're predisposed? Could it be that they have turned on? So we all have cancer genes, right? But it's whether we turn them on or not as well. And somebody can live a textbook healthy life, but that never takes into account what's the chatter in the mind. This is where you're the experts, where, I mean, I can't remember the statistics, but how many thoughts do we have a day in our brain, that we're just saying to ourselves, that we're not speaking out loud. We're constantly talking to ourselves. Or sometimes trauma has happened. And it goes into you on a cellular level. And if it's not dealt with, you think you've moved on, you're high functioning, you're alpha male, alpha female, you're hitting all the marks. But if something, and I've certainly seen this with one of my patients, if you don't deal with it properly, then it's embedded. And then over the years, like you say, 8 to 15 years, things can just build up slowly, because we all have cancer genes, but normally we clear them up. We clear them out with something called autophagy, and our body is constantly scanning ourselves to clear out those pathological cells. But for example, if you take a trauma hit, a psychological hit, and don't deal with it, where's it going to come out eventually? You have to ask yourself, is it going to come out? If it's not coming out psychologically in behavior and relationships, where else is it going to come out? With IBS, for example, we know stress and IBS, when somebody is stressed. So I know when I was in medical school, everyone always had to run to the loo before an exam, because you need to go and take a wee. With IBS and stress, we know that people suffer with diarrhea, and they have the colonoscopy and they have the gastroscopy, and there's nothing to find, and yet the patient comes back and says, but I am having abdominal pain, I am having bowel symptoms. So what is going on? Well, something is going on. There's nothing visible on the camera, maybe, and we try different drugs and nothing happens. So, but it's not made up, because they're having the symptoms, but it's about finding harmony and balance between the mind and the body.
And, from my journey as well, with the inner work and that self-talk and, the emotional stuff that's trapped, that's, we've suppressed, that we haven't felt we had to, acknowledge. It's so powerful, because again, our body is like a channel, and the only way to heal is by feeling, is by releasing, is by expressing. And like you say, and again, we're not taught this. It's this whole thing of we don't know what we don't know. And the amount of times I have like face planted myself going, oh my God, because it makes a lot of sense as well. And especially when it comes to the power of our thoughts. There is no such thing as a pesky little thought. And that's not to be fearful of them going, oh my God, I'm afraid to think the negative now. No, it's our dominant, unconscious, habitual thoughts. Like you said, neuroscience says, we have between 60 and 70,000 thoughts a day. And of those 60 or 70,000, 90% are the same as the day before and all the previous days. And of those 90%, 80% are negative.
Wow. Oh gosh. Yeah.
So we're thinking the same old thoughts and the same old negative thoughts over and over again, over and over again, over and over again. But again, they're subconscious. We're not even aware. So, even by looking at that as well, because it affects our biochemistry, and beginning to be aware of what we're saying, what are our habitual stories. We're great for complaining in Ireland and like talking negative all the time. And it seems fun. It doesn't seem harmful, but it does add up. The body gets that message over and over again, over and over again. And that's what we're programming in. So that's what we're going to express as well in one way or another. So there's just and that's why it's not a one size fits all. It's nobody's fault, because we don't know what we don't know. But yet we're not powerless. We're not helpless. And I say as well now, we live in a toxic environment. Like the world is just toxic. But again, that's not to live in fear. But I take an approach of just damage limitation. I'm going to do what I can do to best support myself. That's not going to say I'm immune from everything. Absolutely not. But at least I'm being proactive. Because a lot of what we do helps us on so many levels. Like you say, it's not a one size fits all. Like when we do any kind of positive, supportive inner work, emotional work, looking after our diet, our stress, exercising, positive thinking, all those kind of things, they have a knock-on effect on multiple levels in the body. So what are some of your favorite protocols or tips, I don't know if you call them tips, to share with people, to help themselves, one, feel more empowered and feel like they have more control over their health and well-being, and two, that are just really supportive as well?
Yeah. Okay. Well, the first thing is just to come back to your point about being in a toxic world and power that we have. A very simple example is listening to the news, right? So when do we ever hear a good story? Sometimes they do like a little light-hearted story at the very end of the news at 10. And I hate listening to someone here has died, this has happened, this is going to happen, a lot of bad predictions, right? But what can you do? You can turn it off. And suddenly you've taken back some of your power. That is autonomy. That is power, to choose not to listen to that. Because let's listen instead to all the really wonderful, heartwarming stories of human connection. My gosh, they are the things that melt my heart, and it radiates joy. So, it sounds like a small thing, but not allowing things like that to come into your environment is huge. Be discerning about about the company you keep. Gossip is a low vibration, is negative. Don't hang out with people who just want to gossip about other people or talk badly about other people. When you get together, there's a very old saying, which is, if you don't have something nice to say about somebody, don't say anything at all. But actually, let's go one step further, and let's always look for the beautiful things that you can say about people. When, if I call you, I'm not going to call you to talk badly about someone. When I want to connect with you and have an uplifting conversation, because, then I will be bouncing on clouds all day long. So coming back to patients and what would I do with them? The first thing is I would tell them things about, for example, about the Radical Remission book and series, because they often, when someone gets a cancer diagnosis, they feel like they are lost at sea, on their own, and they look around and there is nothing. So for you to then provide them with examples, true examples of people who have made these radical remissions, immediately opens up a door that at the moment isn't open to them, that they haven't even thought about. Because they say when you're in a consultation when a patient is in a consultation and they are given a diagnosis of cancer, that patient will retain about 10% of what is told to them afterwards in that consultation. The minute they're given that diagnosis, they're deaf. They don't hear anything else because they've heard the C word. If you can empower people with stories of other people who have recovered, the minute I think that you start to proactively search for things, doors start to open and windows start to open, and then you come across something else and that really resonates with you, and then you learn about this, and then that doesn't quite resonate with you, so you leave that, but then it leads you to something else and you think, oh my God, I never knew about that. But it starts you on a path to learn about things and realize, gosh, I didn't know any of this. It was never told to me. And look at all the possibilities, look at all the treatments, look at all the things that are out there. So I think that's probably the biggest thing. I would advise on nutrition and things like fasting and different things like that, but you do need to be followed up by a doctor for that.
Yeah,
but
tailored to each person.
Yeah, exactly.
Each person's circumstances.
Exactly. But I think if you can give somebody that spark of hope, we know it changes our chemistry. We know it changes our outlook. So I think, medicine is an art, not a science. And the art bit of that is never forget that human connection. Never forget how you can lift another human being. That is medicine. That is one of the most powerful medicines.
That's beautiful. Yeah, I really love that. And like you mentioned as well, if you're constantly watching the news and it's saying 1 in 3, 1 in 3, 1 in 3, 1 in 3, we have to realize that we are being programmed. Our subconscious is wide open. It is listening all the time. And we may consciously think, oh yeah, I know that's just a commercial and I'm not taking it serious. But our subconscious doesn't know. And it is going straight in. And again, it comes back to what you said, our energy follows thoughts.
Yeah.
But that also means the negative, if we stay there. But again, it's also seek and you should find. Everything is there. Actually, everything exists. It already exists. But it's where is our consciousness? Where is my focus going? Where is my attention going? Because that's what we will see.
Yes.
So that's why opening up to new possibilities, finding books, connecting with other people, looking on YouTube. There's so many people who share in their stories who have survived, who are thriving, it's like seek and you shall find, but you have to have that curiosity. You have to have that interest and that care and that willingness for yourself to defy what people are telling you and find another way. And it is possible.
And to trust yourself, right? Because when you've got people in authority and loved ones as well, with the best will in the world, but you've got them telling you must do this, partly it's because they're scared, right? And they're telling you this because they're coming from a place of fear. But that little voice inside gets quieter because you're listening to the outside influences. But you know that inner compass never lies. How many times have you a thought passes through your mind, oh, I should do this, and you don't act on it, and then 2 days later it's like, why didn't I do that? Right? Because you've had the thought, it went through, you left it, and then you realize, I should have brought that bag to work, I should have done this, I should have done that. So yeah, it's I think if you can just give that spark to somebody, then it unfolds beautifully. It gains momentum as well, because you're on the right pathway, the right energy, let's say.
Yeah, I believe that as well, because, we're not just a physical body having a human experience. We are a spirit having a human experience, and there is that guidance. And I love that, because we are the only single best authority over ourselves. Because we are the only person who can hear our inner voice, that gut feeling, that tug. And again, like you said, that doesn't lie. But it can be scary to step into our power, because again, we're listening to everyone else and we're like, oh God, I don't know, maybe I should trust this person, or I should trust this, or I should try this. But no, we really need to. And that's part of the journey as well. Really need to learn to trust ourselves.
Oh, I couldn't agree more. I've done it a billion times. I've thought something, but because I'm not sure enough in my own decision making, and I haven't trusted myself, and I've taken someone else's advice, and it's never worked out.
And again, it's not all bad. We can take whatever resonates, like you mentioned earlier. Take what works, take what resonates, and forget the rest. And then, like you say, just keep following your own guidance, your own intuition. Maybe taking in another little nugget, forgetting the rest. Like, no, that's not for me. And it's all okay. It is all okay. And that's the beauty of it, that there is nothing, actually, when you get into the nuts and bolts of like life and consciousness, there is actually nothing fixed and rigid and concrete and absolute truth. And that's why we can find our own ways. So this has been so wonderful. I thank you so much, Maria. And please, if there's anything you wish to share before we finish, please do. And please also share where people can find out more on your work.
So I would say to every single individual, to every patient who walks through my door, you are perfect exactly as you are. You are absolutely perfect. There is nothing wrong with you in any way. You are perfect. And then things will unfold for you, whatever that path may be. But just remember that you are perfect. Modern medicine and Western medicine is phenomenal, and it does save lives. And it has revolutionized how we live. And for sure, if I get hit by a truck, I don't want a yoga practitioner. Get me all the surgeons. I want the vascular surgeon. I want the general surgeon, the orthopedic surgeon. Give me the drugs. Give me the antibiotics. There is a place for all of that. Absolutely. If I have low mood, or if I have type 2 diabetes, however, before we jump to an antidepressant or jump to metformin or insulin, there's a lot there that could be done. So, maybe there with low mood, maybe I do need the yoga teacher. Or with the diabetes, it would be great to talk to somebody about food and lifestyle and learn about that. So I think it's about finding that balance between when we need, between modern medicine and lifestyle and all the other treatments and therapies that abound these days, and making that blend and a bespoke blend for each individual. In terms of finding me, so my website is dramasanti.com. So that's Dr. Amasanti, AMASANTI.com. And I'm on Instagram as well, and that's dr.amasanti. And you can find me on there.
Fantastic. Thank you so much. And as always, I will have links as well from the show notes on my website directly to your website and social. And thank you so much, Maria. It's wonderful. And thank you for joining in this series as well.
Oh, it's been an absolute joy to talk about these things with you. It really has. It's going to keep me bouncing on clouds all day long.
Thanks for listening. And before you go, I would love to ask you a massive favor. If you enjoyed this episode or any episode of the podcast, I would love for you to leave a short review on Apple Podcasts to help it grow. If you could do that, I would greatly appreciate it.